Joining us on the line is Doug Badger, visiting fellow in domestic policy studies at the Heritage Foundation. His career in public policy spans more than 3 decades. It includes stints as a policy advisor to the White House, the Senate, Department of Health and Human Services, Social Security Administration. Doug, thanks so much for joining the show. Really appreciate it.
Thank you for having me.
So let's talk about the government's COVID-19 policy. I'm amazed, frankly amazed, that the narrative that seems to have come out over the past year of government incompetence is that we need to trust the government more when it comes to public health issues. It's hard to believe how many ways and times the public health infrastructure of the United States botched COVID-19, from the original recommendation not to wear masks, to the FDA blowing the tests in the first place, to the CDC getting it wrong on everything from schools to now the restrictions that we should use with regard to vaccinations. And yet there seems to be this constant media drumbeat that you have to, quote unquote, listen to the experts. The experts have been wrong about this thing about 1,000 different ways.
Yeah, that's absolutely right, Ben. You've given a good recitation of it. I mean, the latest is surfaces. You remember early on in the pandemic, we saw all these studies about how long the virus could, quote unquote, survive on wool or cotton or plastic and so on and so forth. CDC has known for a long period of time now that the risk of transmission from surfaces in the home, I'm talking about, obviously not in hospitals, which carry all kinds of diseases, but surfaces in the home, you really have a very low risk of transmission of the virus. They finally revised their science brief a couple of weeks ago to say, oh, well, you know, the chances are remote. But if you go onto their site, their advice on cleansing surfaces, disinfecting surfaces, it still says that this is part of the plan to reopen America, that Americans should be wiping down their counters with disinfectant wipes, which has been good for Clorox. Clorox wipes are still in short supply, but they have very little value in protecting the public.
Doug, you know, it really is fairly incredible how long it takes these government agencies to even shift course. I mean, we knew this way back in like May of last year. I remember when we would go grocery shopping. I would go grocery shopping for my family because my parents were staying with us and I was younger. So I'd go pick up all the groceries. I'd come home. And I remember us washing each individual item because there was all the talk about the surfaces. And then within a couple of months, it became clear from the data that was being presented that surfaces were not a main vector of transmission for this thing, and that it was actually quite rare for people to get this simply from surface contact. It took the CDC like almost a year to come to that same conclusion, and now we're seeing the same nonsense with regard to the behavior that we should embrace and engage in after vaccination. It is incredibly obvious at this point that once you are 2 weeks out from your final vaccination, you should just go back to regular life. You shouldn't be wearing a mask. You shouldn't be worrying about stuff. You have now lowered your risk of dying or getting seriously ill from COVID-19 to below your risk of the flu. I mean, that is what the vaccines are designed to do. They're 99% effective if you're talking Pfizer or Moderna in preventing death or serious disease. There's no evidence whatsoever that vaccinated people are passing this thing asymptomatically. And yet you still have Anthony Fauci out there every single day telling people who are vaccinated they need to wear masks for some odd reason. He can't explain it. He can't explain when we should stop wearing the masks. And yet he is the guy who's on the cover of In Touch magazine and being treated as America's greatest doctor outside of Dr. Joe Biden, of course.
No, that's right. And with the vaccinations, it's particularly egregious. I mean, Dr. Fauci has been asked at least 2 congressional hearings over the last week or so to produce a single study saying that people who have been fully immunized are at any kind of appreciable risk of infecting other people. And generally, he deflects and changes the subject because there is no study. Dr. Walensky, who heads up the Centers for Disease Control, said on Rachel Maddow, so this must be true, that people who are vaccinated do not carry the virus, and that's been shown both in the clinical trials and also in real life. And if you go on the CDC website, you will see several studies that they reference, 2 of which were published in New England Medical Journal, confirming that the risk of a vaccinated person becoming infected and infecting someone else are minuscule. And yet, as you say, we're told that even those of us who are fully immunized, you need to wear a mask.
You know, the fact, Doug, that so much of this has been gotten wrong, and yet the media continue to promulgate the idea the government is totally doing this right, the Biden administration is handling this correctly. it seems to me that there has to be a deeper agenda here, and that is to prolong the pandemic so as to push forward the idea that government needs to be involved in every area of your life. If you're a big government fan, this has been the greatest period in American history for you. We've spent $7 trillion over the course of the last year. That doesn't include the new $2 trillion package that was just passed last month, or the $2 trillion package that Joe Biden is attempting to pass this month. And the problem is that most Americans are starting to realize, hey, wait a second. If I'm vaccinated, I can go out, I can do what I want. If I'm young and healthy, the chances of me dying from this thing were already incredibly low. And now that there are fewer vectors of transmission, there's a fairly low chance that I'm even going to get the thing in the first place. I mean, we are down to the sort of transmission levels that we haven't seen since before the winter surge. And yet the media keep pushing this feeling of crisis. I can't help but think the reason they're pushing the feeling of crisis is because they'd like for Joe Biden and the Democrats to ram through a few more world-changing spending packages before people get the hint that they can go back to work and they don't actually need all this help.
Yeah, it's hard for me to read their motives. I mean, certainly for the media, panic porn sells, and so they certainly have a financial interest in promoting panic. What is more telling to me is the fact that public health officials who tell us that they're following the science and urge us to follow them along are really not following the science. And I'm not saying that this is because of some strange internet theory. Go on to the CDC website, look at their what they call science briefs, which recite the studies that are presumably underlie their advice, and in many cases with surfaces, with vaccinations, with the protective value of masks and so on, they're simply not doing that, and they're taking an approach of trying to inspire fear in people. Rochelle Walensky, the CDC director, said a few weeks ago that she has a recurring feeling of impending doom. I don't care about the CDC director's theories or her feelings, as important as they may be to her and her family. Where is the science that says we should be disinfecting surfaces and that immunized people should be wearing masks? And that masks protect you against being infected. There is no strong science behind any of those pieces of advice.
Well, that's Doug Badger of the Heritage Foundation. Go check out his work at heritage.org. He, of course, is visiting fellow in domestic policy studies. Doug, appreciate your time and your insight.
Thank you, Ben.
Thanks for watching the Heritage Foundation's YouTube channel. With more than 500,000 members, we are the nation's largest conservative research and education institution. We believe the principles and ideas of the American founding are worth conserving and renewing. Please help us further our mission by subscribing to this channel and sharing our videos with your family and friends.